All right, I'm going to provide hand hygiene and apply my gloves in order to administer and prepare for medication for our patients. All right, so our patient today is going to be Valerie Voss. Patient, we're at the right room. It's room 222 on the 3rd floor. Her date of birth is 5/22/1930. All right, right patient, right medication. I'm going to check for the right dose. I'm going to make sure I do the right route, time, and it's documented here on the MAR. All right, so first we're going to begin. Our first medication is acetaminophen. All right, so it's a capsule for 650 milligrams by mouth twice a day. This is going to be her first dose of the day. All right. So acetaminophen, the order is 650 milligrams by mouth. The supply is 325 milligrams per tablet. So Ms. Valerie will receive 2 tablets. All right. So 2 tablets of acetaminophen, 325, so that was 2 tablets. All right, our next medication is going to be azithromycin capsule. The order is 250 milligrams by mouth 4 times a day. This will be her first dose of the day. All right, azithromycin. All right, so acetaminophen, that was 650. The supply was 325 per 1 tablet. So let me just double check. 650 divided by 325 times 1. All right, so acetaminophen, just double checking, that was 2 tablets. Now the azithromycin capsule was 250. The supply was 250 per 1 tablet. 250 divided by 250. All right, so that's going to give me 1 tablet, so I got that. All right. The next one is magnesium hydroxide, 800 milligrams suspension by mouth. That's 3 times a day. This will be her first dose of the day. So we said 800 milligrams is the order. The supply is 400 milligrams per 5 mLs. All right, so let's do the calculations just to double check. All right, so that's 800 milligrams divided by 400 milligrams. It's going to be 2 times 5 mLs. So Miss Valerie is going to receive 10 mLs of magnesium hydroxide. So 10 mLs. I'm going to put this on a flat surface. And I'm going to administer 10 mLs. Of magnesium hydroxide. All right. Next for Miss Valerie, we have Offs-NURS 0.3% audit drops, 5 drops in both ears twice a day. So this is going to be her first drop of the day. So we're going to do 5 drops in both ears. So I'm going to just double check. Offs-NURS 0.3% audit drops. All right. Offs-NURS. All right, we have Offs-NURS, the audit drops, 0.3%. Expiration date's good. It's clear, not cloudy, and there's no odor. All right. And we're going to do 5 drops of this in both ears. Next, we have pilocarpine, 4% ophthalmic drops. It's 1 drop to the left eye twice a day. This will be her first dose today. So 1 drop in the left ear for Miss Valerie, and that's the pilocarpine, 4%. All right, so I'm gonna just double check. Pilocarpine, 4%. Expiration date's good. There's no odor and it's not cloudy. So we're just gonna do that in 1 drop in her left ear. I'm sorry, left eye. All right. Next we have potassium chloride. It's gonna be a tablet. We want 30 by mouth daily. So that was potassium chloride. All right, so that's a 130 tablet. All right, so our supply is gonna be 10. So I'm gonna make sure to get, I'll make sure to provide a full one of these and then a half of this. The order is 30 and the supply is 20. So I'm gonna do 1 1/2. So that's gonna be an order of 30, a supply of 20 per one. Okay. 20. All right, so that's gonna be 1 1/2 tablets of the potassium chloride. So I'm gonna make sure I have my pill cutter so when I'm at the room I can cut the pill for her. All right, so that'll be 1 1/2 tablets. All right, on to the, all right, her blood glucose is 250. So you have 250 minus 100 divided by 3. That's going to be 150 over 3. So the insulin is going to be 5 mLs of regular. Units. The NPH is going to be 6 units. So we have 5 units of regular insulin and 6 units of NPH. All right. All right, to begin, okay. All right. All right, so I'm gonna roll my regular insulin. Gonna wipe it down for 5 seconds. I'm gonna roll my NPH. I'm gonna wipe that down for 5 seconds. All right, so my total is going to be 11 units total. So I'm gonna draw up my air for 11 units. Drawing up my air for 11 units. I'm gonna inject my air into the cloudy. For the cloudy, I'm gonna inject 6 units. For my regular, I'm gonna inject 5 units. And then I'm going to draw 5 units of my regular. And then I'm going to draw 6 units for my NPH. So, total of 11 units of insulin. Okay. Check for air bubbles. All right. So, I've got my insulin and I have my NPH ready. All right, next we're gonna go to the next I'm gonna do hydromorphone HCl injection, 1 milligrams IM. Okay. So I have my hydromorphone HCl injection. I need 1 milligram. Okay, so I got I need 1 milligram. Okay, and I got my needle. It's going to be the gray needle. I'm going to place my needle in here. Gonna wipe my valve for 5 seconds. All right, I'm gonna inject 1 ml of the hydromorphone HCl. One first. Okay, I'm gonna re-wipe it. For 5 seconds. All right, I've got my air drawn up. I'm gonna inject the air and pull back for 1 ml. No air bubbles. Okay. All right, so the correct patient, Valerie Voss, room 222, 3rd floor, date of birth is 5/22/1930. I've got all my medications. Yeah, this is a silky, okay. I'm going to label my injections. One's insulin, one's all right, this is my insulin. This is my IM medication. Alright, so I've done my MAR at my cart. Now I'm going to check my MARs outside of the room. Okay, I'm outside of the room. Valerie Voss, room 222, date of birth 5/22/1930. It's the right patient, the right medication, the right dose, right route, time, and documentation. I will double check that as I'm in the room. All right, everything looks good. Okay. Knock, knock. Hello, Miss Valerie. My name is Brianna. I'm your nurse today, so we're just going to administer some medications. We're going to be doing that. We're going to be administering medications in some different routes. I'll explain that as we go. I'm going to provide privacy for you. All right. Provide privacy. Do some hand hygiene. All right. How are you doing today, Miss Valerie? Good. Are you allergic to anything? All right. I see on here that you are allergic to sulfa drugs and erythromycin. Okay, we're not going to administer that today. Just wanted to double check. So you're not sure if you're allergic to erythromycin. Okay, I'll just call the physician and we won't administer it. I can just, we'll go ahead and give you what we have, and then when we leave the room, we'll just, I'll call the physician and verify. Okay, thank you, you too. All right, we're gonna raise the bed. You're not experiencing any pain in your lower abdomen or your side thigh. Are you having a good day today? Okay. You're gonna raise your bed. Your ventrogluteal, are you having any pain in that? Okay, perfect. All right, let me just double check your name and date of birth. All right, Valerie Voss, room 222, date of birth is 5/22/1930. Perfect. All right, I'm gonna lower this. All right, so first we're just gonna begin with some oral medications. Can you say "ah" for me? Okay. Here's a glass of water. Can you just take a sip for me? Swallow and say "ah." Oh, perfect. Full glass of water you enjoyed there. All right. All right, this is going to be your, let's start with the acetaminophen. Okay, here's your acetaminophen. All right, if you will, open it up. All right. Say "ah." Open your mouth all right. Okay, you didn't have that anywhere. Okay, next. All right, so there's erythromycin you are allergic to, so I'm not going to give you that today. Well, I will talk to the physician about that. All right, now we have the potassium chloride. Your order was 30, so we're going to give you 1.5 tablets. All right. All right, so that's 1.5 tablets. Let me get you another glass of water. All right, 1.5 tablets. All right, can you say "ah" for me? All right, perfect. Those go down quick. All right, and lastly, we have your magnesium hydroxide. We're going to have 10 mLs of that. All right, here's your glass of water. All right. Next, we're going to begin with the ear drops. So that was Offs-NURS. That's 5 drops in both ears. 0.3 odic. All right, so Offs-NURS. Expiration date's good. All right. Are you having, so will you just tilt your head this way? Okay. All right, and we'll pull your ear out and back. 1, 2, 3, 4, 5. I'm gonna press on your tragus. All right, if we can do the other side, we're going to do the same thing. Ear out and back. 1, 2, 3, 4, 5. Push on your tragus. Good job, Miss Valerie. All right, next we're going to go ahead and go with the pilocarpine 4% ophthalmic drop. 1 drop to the left eye. No odor, no smell, and the expiration date is good. All right, so 1 drop to the left eye. All right, I'm gonna administer that on this side. All right, I'm gonna put that up and down. 1. All right, with a cotton ball in my hand, we'll press up against it for 2 to 3 seconds. All right. Good job. All right. All right, now we're gonna administer your insulin. Are you feeling any soreness in your abdomen? All right, this is just your insulin. All right. 1, 2, 3. All right, good job, Miss Valerie, excuse me. All right. Now, next, we just have your IM medication. All right. Next, we have your IM medication. I'm going to clean my injection site in one direction for 5 seconds. Jesus. All right. We're going to do this ventrogluteally. All right, so, excuse me, I'm going to, all right, so this is going to be the area in between my middle of my index finger. So I've cleaned the site. All right. So I've administered that. All right, Miss Valerie, is everything okay? All right, well, here's your call light. Call me if you need me. I'm gonna let your bill back up. And I will let you know what Dr. Pete says about your erythromycin. All right, I'm gonna put my needles in the sharps container. All right. Okay, have a good day.